Hello everyone. Today's video is a Q&A video talking about Akkermansia, talking about methylene blue, talking about blepharitis, rosacea, and telangectasia, just to round it all out. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you don't mind taking a quick moment at some point to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question here is, do you think taking Akkermansia, which is a probiotic that is now available on the market, Akkermansia muciniphila, do you think taking Akkermansia on a carnivore/keto diet would be okay? Someone mentioned that without a high fiber diet, Akkermansia could increase food intolerances. So thanks for the question. Yeah, I've honestly have not heard that before. I've taken a look at the research literature on Akkermansia, and I can't claim to have done an exhaustive search on it. I haven't written a white paper on it or anything like that, but I didn't come across anything about that in terms of side effects coming up from taking Akkermansia on a low fiber diet causing issues. And to be perfectly frank, with Akkermansia, having taken a look at the research literature, to my understanding, there are very few interventional trials with Akkermansia. Most of the research literature on Akkermansia is looking at the differences between folks who have higher versus lower levels of Akkermansia and the different health conditions that those folks are more predisposed to. So for example, if memory serves, folks with lower levels of Akkermansia have a higher rate of, say, having metabolic syndrome, for example, or might have more issues with their blood sugar regulation, for example, or maybe more issues with bowel conditions like inflammatory bowel disease. But in terms of actual interventional trials where it's like, oh, we're going to give you Akkermansia, we're going to give you placebo and in the different groups and then see what the outcomes are, very little research has been done in that regard so far. I think that will start happening more and more as Akkermansia is now available as a supplement, as it has been for, I think, maybe a couple of years now. And I think there's better formulations that are available now than there were a couple of years ago. But to have any objective data pointing us in that direction, I don't think there's anything from the published literature showing that. Now, that being said, if someone has been prescribing this, to many patients over time, and they've noticed this as a correlation, that's evidence too, but I haven't heard of anyone saying that. I haven't come across that at all. So if there's a specific, I don't know, resource that a blog post or a study showing that, please consider posting that in the comment section, and I'd be curious to take a look at that, but I have not come across that. I also just don't really see how it would cause more food sensitivities in the absence of an adequate amount of dietary fiber. So anyways, those are my thoughts on it. I'll leave it there for now, but thank you for the question. And I personally, for my patient population, wouldn't hesitate to prescribe it to folks who are following a keto or carnivore diet. But I reserve the right to change my opinion if I see something different that comes along. All right, next question here is about methylene blue. So it says here, as a new user of methylene blue, I'm just trying to stay informed. I'm about 2 months in and don't really notice any changes in symptoms. Fibromyalgia, chronic fatigue syndrome, celiac disease. I do think I'm sleeping better. See my doctor in February, so I'll discuss with him, of course. But after reading about people who had dramatic changes, I feel disappointed. Wondering if taking it will I see more improvement, or is it just not working for me? So yeah, thanks for the question. And I'm sorry to hear you're not feeling better. It's always disappointing to try something new, especially something that has a lot of hype, and then not really see a difference from it. Again, obviously, you'll talk to your doctor, get tailored advice for you, but just speaking academically here, as I've said in some of my other videos where I talk about methylene blue, there are plenty of patients that I've had who don't see any difference from taking methylene blue. I'm generally healthy. I thankfully don't have any chronic health issues. Used to, and resolved those a long time ago. Thank you, naturopathic medicine. But I take methylene blue and I don't feel any different. So for using it as a biohacking tool, I don't see any difference. But I have other patients, they take it as a biohacking tool and they're like, oh, my focus is better, my cognition's better, all these great things. And then I've had many patients where they do benefit from taking methylene blue, whether it's for their brain fog, for their chronic fatigue. Those would be the main things that I see improvements with, by and large. Sometimes maybe some circulatory improvements. And there's a lot of benefit, and other patients take it and they don't really see any difference. So Again, dosage is important, but I mean, by and large, the dosages that most folks are using are going to be in the antioxidant range. Really high methylene blue becomes a pro-oxidant, more of an antimicrobial at that stage or at that level. But at lower dosages, which is what most folks are taking, as an antioxidant, if I have a patient who takes an antioxidant and they don't feel better, then the take-home message for me is that they weren't low in antioxidants in the first place, or there's some other thing going on that needs to be treated at the same time, and maybe they do need the antioxidant, but they need something else too. So if I have a patient in my practice, they've been taking methylene blue for a couple of months and haven't seen any difference, I'd be thinking either your antioxidant status is okay and there's other stuff going on, or maybe there's some other concomitant issue that needs to be addressed as well. The question was not about this, but I'm going to say it anyways because it's relevant to the question, the topic here. For patients that I see who have fibromyalgia and chronic fatigue syndrome, by and large, those patients they're all dealing with mitochondrial dysfunction in my experience, in my practice, and there's always a cause for that. And in many cases, it's something like chronic infections, mold toxicity, maybe heavy metals or other toxins, sometimes there's always a nervous system dysregulation component, but sometimes that's a large component of it. And so when I think about methylene blue if I have a new patient that comes in, they have chronic fatigue syndrome, fibromyalgia, I'm usually not thinking like, oh, I'm going to put them on methylene blue and that's going to make all the difference in the world, because there's probably so much more going on with their cellular physiology beyond just an antioxidant deficiency, and they might not have an antioxidant deficiency in the first place. One of the things that goes kind of hand in hand with having lower energy conditions with low energy like chronic fatigue or fibromyalgia is the mitochondria are dysfunctional. They're not producing enough ATP, enough cellular energy. Well, one of the byproducts of ATP production are free radicals. So it's possible that folks who have chronic fatigue or fibromyalgia might actually have lower levels of those free radicals that would mean that they don't need as many antioxidants in the first place, which could also be a predisposing factor to not responding to methylene blue. Now, if that patient has lots of heavy metals or mold toxins or other things that are going to drive a lot of free radicals, well, then that's going to be a different kettle of fish. But that's where we get into the nuances of, every case is a little bit different. I'm going to leave it there for now. I hope that was useful information. The last one here. So individual who has posted on quite a few of my videos over the years. So always nice to see their little picture on YouTube or whatever. So it says, do you have any videos covering telangectasias, blepharitis, rosacea in patients with autoimmunity or persistent infections, etc.? I've seen many doctors over the years, been diagnosed with hypovolemic POTS, poor perfusion of tissue, Sjogren's like systemic dryness, joint pain, neck muscle weakness, DMJ, severe fatigue, stiffness, and then significant rosacea, telangiectasias, and blepharitis. And the doctors have no clue. So thanks for the question. Yeah, I'm sorry to hear about all those health challenges. That is a laundry list of health issues, to say the least. As far as rosacea goes, in my experience, in my patient population, rosacea is oftentimes related to stomach acid levels, oftentimes related to food sensitivities, and then sometimes related to impaired detoxification pathways, all of which are fairly common when there's a myriad other conditions going on. It's not like a one-size-fits-all there, and sometimes rosacea is really hard to get under control, even when we're throwing everything at it, but those are some of the underlying factors I've seen. With blepharitis, I've generally found that if prescription agents aren't helpful, or if it's recurring blepharitis, in my practice I use a topical silver spray, and I found that to be quite helpful. Again, I can't prescribe anything over social media, but that's kind of been my go-to. And I don't specialize in blepharitis by any stretch of the imagination, but I've probably treated a few dozen cases over time, and the topical silver spray has been very effective. So that's something that I found to be quite helpful. With the telangiectasias, my understanding is that can be an indication, at least in my patient population, of lower antioxidant status. And so that can be a bit of a clue that maybe that's something that needs to be worked on, because with telangiectasias, it's basically an issue. Part of the issue is that there's too much fragility or friability of the blood vessels themselves, and that can be associated with lower antioxidant status. So that can also go hand in hand with a lot of those other things that were mentioned as concomitant health issues. So I'm going to leave it there for now. Any other questions, just post in the comment section below, and I'll do my best to answer as soon as I can.